continue on this because I think there's some important issues to bring up here. I wanted to ask you, Dr. Blumenthal, for many physicians, and I get this complaint all the time from physicians in my area, the Medicare and Medicaid reimbursements are already low. And the penalties could further diminish these payments rates for practices that do not transition to electronic health records. I'm afraid in my home state we're going to see physicians turning away from treating anyone who's on Medicaid or Medicare and avoid that financial burden. So has HHS examined how these penalties will affect patient care and access to care?
Well, Madam Chairwoman, I think that the first point I'd like to make is that the American physicians and hospitals now have available $45 billion to support the adoption of health information technology that they didn't have before the Recovery Act. So that's an enormous new investment by the American taxpayer in making this technology possible to adopt. In 2015, those who have not could be the subject of penalties. That's true. It's 1% the first year, 2% the second year, and 3% the third year. It is certainly our hope that those penalties will never go into effect and that the great majority of providers will have become meaningful users by 2015.
That 1%, 2%, 3%, do you have any idea whether those will be physicians from small practices versus physicians from larger practices? I mean, that's what I think the testimony and some of this questioning going forward is that those who are in a single practice or 2 or 3 docs in a practice have a much more difficult time financially.
Sure, I understand that. We obviously don't know 6 years from now exactly who will have become a meaningful user and who will not. And we will, of course, be examining that as time goes on. I do want to point out that the law makes special provision for technical assistance to small practices through the extension center mechanism that we are planning to implement in the near future. This is very retail, hands-on support and help for adopting records and learning to be a meaningful user of that record. So that's part of the $2 billion that we have available to provide technical assistance to small practices and small hospitals, and we're working very hard at figuring out how best to use that money right now.
Is there any provision for more of the funding going towards those practices, percentage-wise?
It's certainly possible that we could do that. The law draws attention to small practices and primary care phicians.
Who would make that decision?
The Secretary would.
Okay. Is there any talk of that currently?
Well, I think we are looking at all the options, Madam Chairwoman, and that's certainly on our mind. We understand that small practices carry an extra burden.